This year alone, we've witnessed outbreaks in Mandera, Wajir, Garissa, West Pokot, and Tana River counties. Only 1 in 5 children are vaccinated with at least 1 dose of measles rubella vaccine. The unprecedented increase in the number of unvaccinated children and accumulation of susceptible children to more than 2.1 million in the ongoing COVID-19 pandemic has aided the outbreak. And I think the media, this is where it's going about 2.1 million children who are at risk of measles and rubella. And this is because we've had different challenges with COVID, we've had challenges with missed doses, and now when we count the number of children who are at risk, 2.1 million children. And that's why it's absolutely important that this campaign is supported by the media in terms of raising awareness, and also, of course, supporting all the healthcare workers, about 16,000 of them who have been mobilized to ensure that they avail this vaccine across the country. This campaign will focus on 22 counties: Kilifi, Mandera, Wajir, Garissa, Baringo, West Pokot, Turkana, Tana River, Trans Nzoia, Elgeyo Marakwet, Busia, Homa Bay, Migori, Kisii, Kajiado, Nairobi, Bomet, Bungoma, Kakamega, Narok, and Vihiga. And to respond to this disease threat, the Ministry of Health, through the National Vaccines and Immunization Program, have planned to conduct this campaign together with partners, running from the 25th of June to the 5th of July. Our target, and again the media, I hope you will hold us accountable, our target is to reach 3.5 million children. And so, Moira, even here in your county, it would be good to know what your target is as the teams go around. Chanjo na anafaa kuleta mtoto wake, so that we can ensure that we really encourage all communities to come down for the vaccination. The vaccines that we are using are the normal vaccines that we utilize when it comes to routine immunization, and so they are safe, and we guarantee the safety of those vaccines. In this great county of Kajiado. Wakazi wa Kajiado, nawashukuru nyinyi nyote kwa kuweza kupata wakati kufika hapa leo. Nimeona kina mama wakiwa na watoto na ninaona wengine wakienda huko kupata chanjo. Kwa hivyo nafurahi sana mmepata wakati kukuja hapa leo. Na furaha yetu ni kwa sababu hii chanjo ya measles na rubella ni chanjo ambayo ni muhimu sana, ambayo itaweza kulinda watoto wetu, kuhakikisha kuwa hawatapata magonjwa mbalimbali. UNICEF country director alipokuwa hapa aliweza kutueleza yale madhara mtoto anaweza pata asipopata hii chanjo. Tukiangalia ugonjwa kama wa rubella, usipopata hiyo chanjo unaweza kuwa na mtoto ambaye ako na hitilafu ya moyo, shida nyingi mbalimbali pia hata za ubongo. Kwa hivyo hii ni chanjo ambayo ni muhimu sana sana kina mama. Na naona vijana wa bodaboda wameingia pia, ningependa pia wasikize, wapate kuelewa kuwa ni muhimu leo wakiwa katika ziada zao mbalimbali waweze kuhakikisha kuwa kama unajua kuna mtoto ako na miezi 9 hadi 59, huyo mtoto anafaa kupelekwa katika kituo cha hospitali, clinic, zahanati ili apate hii chanjo. Has compounded maternal, child and adolescent health challenges. Specifically, the country has witnessed a worrisome decline in childhood immunizations over this period of time. And so it's important that we really focus on trying to improve our childhood immunization coverage, particularly when it comes to measles and rubella, where we still have a constant threat of outbreaks. Waziri wenyu Somoire ameweza kutueleza kuwa kuna zile kesi katika hii kaunti yenu. Ndiposa ni muhimu nyinyi kina mama muweze kuleta watoto wenu, na hii campaign ambayo itachukua kama siku 10 hivi iweze kuwa ni campaign ambayo imeenda vizuri na tumewapata watoto wetu wote ambao wanafaa kupata hii chanjo. This year alone, we've witnessed outbreaks in Mandera, Wajir, Garissa, West Pokot, and Tana River counties. only 1 in 5 children are vaccinated with at least 1 dose of measles rubella vaccine. The unprecedented increase in the number of unvaccinated children and accumulation of susceptible children to more than 2.1 million in the ongoing COVID-19 pandemic has aided the outbreak. And I think the media, this is where it
are at risk of getting measles out of a birth cohort of about 1.5 million. Based on this risk profiling, therefore, it means that we stand a risk of a huge outbreak of measles and rubella disease like happened in DR Congo with a very high mortality rate. And you cannot fathom an outbreak of such magnitude with the ongoing COVID-19 pandemic and the situation that is happening in the western belt of the country. Because if you look at the complications of measles and rubella, again, they are also mostly respiratory, including pneumonia, which may require support in terms of oxygen, and for serious cases, even ventilatory support. And our healthcare system is already very, very stretched with COVID-19. So because of we still go ahead and conduct this campaign to ensure the safety of our children who are the future leaders of this country. I just want to appeal to the members of the public, parents, guardians, community leaders, religious leaders, political leaders, everybody from all walks of life, to support the campaign by ensuring that we bring children aged 9 to 15 months to the vaccination points, either through the mobile vaccination centers or fixed post-health posts, so that the children can receive the vaccine. I want to assure you that the Pharmacy and Poisons Board and the National Quality Control Lab, and it is the same vaccine that we have been using for our routine immunization process. And therefore, nobody should shy away and deny a child the right to be able to get this vaccine and to be protected. I am confident that as a nation, again, we are going to deliver a success.
22nd January 2019, the Kenyan Ministry of Health notified the WHO of a cholera outbreak in Narok and Kajiado counties. The outbreak was first detected on 2nd January 2019 in Narok County, followed by Kajiado County a week later. In the same year, in the month of March, an index case of measles was reported on 11th March 2019 in Mosiro Ward. Many cases were later seen between the months of June and July, totaling to 425 cases with 1 fatality. In our routine immunization program, Kajiado County has coverage of 90% for measles first dose. Our county government has continued to increase health accessibility through building of new facilities, expanding services in the existing ones, and our 5 hospitals and other primary healthcare facilities.